Let's dive into the typical short case scenario where you encounter a stable patient with one or more clearly identifiable physical signs. The case stem provides specific instructions on which physical examination to perform, sometimes directing you to focus on a single organ, such as examine the heart, or on an entire system, like examine the cardiovascular system. Your objective is to perform a detailed, methodical examination, confirm your findings, and be ready to discuss a differential diagnosis based on your observations. Start by following the guidance provided in the case stem. Focus intently on the designated system or organ. For instance, if you are instructed to examine the heart, begin with examination of the heart. Concentrate on identifying the key physical sign, whether it's a cardiac murmur or another isolated finding. When evaluating a murmur, pay close attention to its timing, location, and quality, and be precise in grading its severity using standard auscultatory criteria. If asked to examine the cardiovascular system, then examine the entire cardiovascular system following the template for the comprehensive exam, rather than merely examining the heart. While your initial focus is on the primary area indicated, remain vigilant for any additional signs that might emerge. Some cases may present only a single sign, like a murmur, whereas others may reveal more complex findings such as peripheral stigmata, palpable organomegaly, or evidence of previous interventions. The ability to extend your examination beyond the obvious demonstrates your clinical acumen and readiness to integrate all findings into your overall assessment. As you progress with the examination, take a systematic approach to integrate your observations. In some scenarios, additional physical signs may become apparent as you examine the patient. For example, when assessing a patient with chronic liver disease, you might observe hepatosplenomegaly alongside peripheral stigmata. In more complex cases, such as with a renal transplant patient, you may encounter multiple findings: bilateral palpable polycystic kidneys, a palpable transplant kidney, signs of an arteriovenous fistula from previous dialysis, and even peripheral neuropathy due to immunosuppression. It is essential to correlate these new findings with the primary abnormality to build a coherent clinical picture. Once you have completed your examination, synthesize your observations to form a cohesive narrative that supports your differential diagnosis. For instance, if you're evaluating a cardiac murmur, consider possibilities such as valvular heart disease, congenital defects, or functional murmurs. Articulate the possible etiologies for the most likely diagnosis and justify your reasoning with the evidence gathered during your exam. Additionally, prioritize the findings. Determine which issues require immediate attention versus those that are secondary or chronic. Your ability to effectively prioritize reflects strong clinical reasoning and guides further investigations and management plans. To prepare for these scenarios, regular practice is key. Engage in simulated cases that mirror the structure and complexity of real-life clinical situations. Focus not only on the technical aspects of the physical exam, but also on the thoughtful integration of your findings. Discuss your approach and reasoning with peers in study groups, and seek constructive feedback from mentors to continuously refine your technique and clinical judgment. In summary, a typical short case challenges you to conduct a focused, detailed physical examination as directed by the case stem. Whether you are dealing with a single sign, like a murmur, or multiple findings, your goal is to integrate these observations into a logical, evidence-based differential diagnosis. By maintaining a systematic approach, actively seeking additional signs, and continually refining your skills through practice and feedback, you will be well prepared to excel in these examinations and in your future clinical practice.